So we actually have a question. You know, before you came, I talked about all social media that you were coming, and we have a live question that came to us from, I believe Mary was her name, and she writes, I fractured lumbar 1 in 2014. The pain is not constant, but it's painful every day during normal course. Would the 1-inch surgery help me at all? What is 1-inch surgery, and what do we tell Mary? Should she go for this, or are there things that she can do to help her?
Right, so a 1-inch surgery is a small microsurgery. Typically that's a surgery we do for a herniated disc, a piece of disc hitting a nerve, where you can go and do a little opening and take pressure off a nerve. With a fracture, which is a broken bone, if it's still painful after 3 years, there's probably some chronic instability there, maybe chronic inflammation. There is a less invasive procedure called vertebroplasty, which is a fancy way of saying put some cement in the bone to support it. She might be a candidate for that, but given that this is going on for 3 years, that would have to be evaluated with an MRI and maybe a bone scan. But for fractures that are causing chronic pain, oftentimes you need a more reconstructive surgery with a removal of the fracture and replacement with screws and rods in a cage to support the spine. That's called a spinal fusion. That's not done through a 1-inch incision. That's more of a major surgery.
Okay, and if you have any questions, you can always reach out to Dr. McCance for a second opinion. I think it's worth your time.